Ultrasound, abdominal, real-time with image documentation, complete. Limited, e.g., single organ, quadrant, follow-up. Report 76,700 for ultrasound and real-time of the entire abdomen and 76,705 for a single quadrant or organ of the abdomen. Ultrasound, retroperitoneal, e.g., renal, aorta, nodes, real-time with image documentation, complete. Limited. Report 76,770 for ultrasound and real-time for a complete retroperitoneal exam that includes renal, aortic, and lymphatic structures and 76,775 for a limited retroperitoneal exam. Ultrasound, pelvic, non-obstetric, real-time with image documentation, complete. Limited or follow-up, e.g., for follicles. Report 76,856 for a complete pelvic evaluation in a patient who is not pregnant and 76,857 for a limited or follow-up pelvic evaluation, for example, to monitor real-time follicle development on the ovary to evaluate gonadotrophin therapy. Ultrasound, extremity, non-vascular, real-time with image documentation, complete. Limited, anatomic specific. Ultrasonography of a complete joint, e.g., joint space, muscles, tendons, and other periarticular soft tissue structures, is performed. Report 76,882 for a limited study of a joint or other non-vascular extremity, e.g., joint space, muscle, S, nerve, S, periarticular tendon, S, soft tissue mass, or other soft tissue structure. Ultrasound, soft tissues of head and neck, e.g., thyroid, parathyroid, parotid, real-time with image documentation. This code reports ultrasound, real-time with image documentation, for the soft tissues of the head and neck, e.g., thyroid, parathyroid. Ultrasound, chest, includes mediastinum, real-time with image documentation. This code reports ultrasound in real-time for the chest, including the mediastinum. Ultrasound, abdominal aorta, real-time with image documentation, screening study for abdominal aortic aneurysm, AAA. This procedure is used as a tool to evaluate for abdominal aortic aneurysms, AAA, by viewing how the flow of blood moves through the abdominal aorta, which shows defects within the artery typical for an AAA. Ultrasound, transplanted kidney, real-time, and duplex Doppler with image documentation. Duplex studies combine real-time with Doppler, which uses the frequency shifts of the emitted waves against their echoes to measure velocity, such as for blood flow. Ultrasound, spinal canal, and contents. Ultrasonography of the spinal canal and its contents includes imaging of the spinal cord, the vertebrae, and the intervertebral discs. Ultrasound, transvaginal. The sound waves pass through different densities of tissue and reflect back to a receiving unit at varying speeds. The unit converts the waves to electrical pulses that are immediately displayed in picture form on screen. This code reports transvaginal ultrasonography. Saline infusion sonohysterography, SIS, including color flow Doppler, when performed. Fluid-enhanced endovaginal ultrasound is done with the saline solution acting as a contrast medium to view any abnormal anatomic findings in the uterus that needs to be further evaluated. This code reports only the radiological supervision and interpretation. Ultrasound, scrotum, and contents. This code reports ultrasonography of the scrotum and scrotal contents. Ultrasound, transrectal. Prostate volume study for brachytherapy treatment planning. Report 76,872 for transrectal ultrasound or echography for either sex. Report 76,873 for a prostate volume evaluation for planning brachytherapy treatment, which involves planting tiny radioactive elements into a treatment area. Ultrasound, infant hips, real-time with imaging documentation, dynamic, requiring physician or other qualified healthcare professional manipulation. Limited, static, not requiring physician or other qualified healthcare professional manipulation. Report 76,885 for dynamic ultrasonography of an infant's hips requiring physician or other qualified healthcare provider's manipulation involving compressing the leg at the knee and prying the hip outward as the sound wave transducer is applied to the hip area. Report 76,886 for static ultrasonography of an infant's hips requiring the legs to be still while the sound wave transducer is applied to the hip area. Echoencephalography, real-time with image documentation, grayscale, for determination of ventricular size, delineation of cerebral contents, and detection of fluid masses or other intracranial abnormalities, including Echoencephalography as secondary component where indicated. Abnormal results may indicate cerebral edema, lesions, or subdural and extradural hemorrhage. This code includes Echoencephalography as a secondary component where indicated.